morning, Dr. Tani, or should I say good evening to you? Anyway, we are back with this AMSEP's Exchange podcast, and we're back with the same host with me, Paul, from the Faculty of Medicine, Rama Tibeti Hospital.
And I'm Pim, also from the Faculty of Medicine, Ramatipati Hospital.
And I am Proi Lung from Faculty of Medicine, Khon Kaen University.
I'm sure most of our listeners have either heard or seen some of your work as well as your contribution towards medicine. But for those who may not be as acquainted with you or with your work as others, could you please give us a brief introduction about yourself, Dr. Tani?
Oh, yes, and thank you so much for inviting me for the talk today. I hope that I would inspire some of the younger generation about all of these international experiences. So I graduated from Chulalongkorn University long time ago, back in 2006. And then I served in the upcountry for 3 years and did an additional 2 years on private practice before coming over to the United States. I did my internal medicine residence at Albert Einstein Medical Center in Philadelphia, and then moved on to do pulmonary critical care at Emory University. Then I did an additional year of lung transplantation at Duke University, and now I'm a faculty at Brigham and Women's Hospital, Harvard Medical School.
Okay, thank you so much. And in this episode, we'll be talking about your experience specifically as a physician abroad, or specifically one in the States. So as you might know, this podcast aims to open Thai medical students' perspective on what it's like to study and or work outside of Thailand. And currently, AMSEP is also pushing this idea by putting together numerous exchange programs as well. So this podcast will surely benefit these listeners.
And aside from your work as an instructor at Harvard Medical School, most, if not all, of our listeners are familiar with your work in YouTube and other platforms for posting content relating to modern day healthcare. We are very privileged to have you here as our guest speaker. I am sure your knowledge and experience in this field will be extremely beneficial to us, current and future medical students. And with that being said, let's get right on with the questions.
Of course, fire away.
Okay, so first and foremost, as we all know, you're currently working and living in the States. So would you mind sharing us the experience of working abroad as a professional? This could range from your work experiences to any social aspect of your work that you would want to share to us.
I would start with my residency first. So whenever you move from one country to another, you have to acquire some of understanding of the social and culture here. And that was, I think, one of the most difficult things. And most of the people in Thailand will struggle for the first couple of months, like typically 3 months. That would be the usual time when people start adjusting themselves properly. Obviously, you have to be alone here, even though you have friends, but you do most of the thing yourself, which is something that most of the Thai people would not be accustomed to, because in Thailand, there are a lot of people helping us out, especially our parents. And we still stay with our parents, I think most of us, right? When you're here, you're basically dependent on your own. The next thing is you probably need to understand the area that you live in, because obviously there are an area that is good and the area that's are not that great, right? Same in every country. In Thailand, in Bangkok, as well as some area you should not be visiting. That is something you should, I think it's the first and most important thing to understand where you should go and should not go in your area. Then obviously you need to understand their culture. And the best way to understand their culture are 2 things. So number one, you have to listen to their news, and not only the news, probably some games, like if you don't know baseball, you don't know basketball, those kind of things, American football, these are something that you should at least get your feet wet to try to understand. At least you can talk to some other people and engage in a very good conversation. And that's what I did when I first arrived here. And always, listen to local news, not just the national news, because the locals are somewhat can get you along and you can talk to people in your area pretty well. And I think those are a couple of things that I just get my feet wet first. And so this way you understand all the cultures. Now, in terms of the hospital setting, I would say most of the Thai people who came here during my time, they don't have any issue with the medical knowledge. That's pretty straightforward and pretty much what we have been taught in Thailand. So in terms of medical knowledge, there's not a problem. And especially any of you who have served the country in probably working after the medical school year for a couple of years, then you have enough experience to even battle any kind of difficulties in each of the patient scenario. So I don't think you're going to be having any issue with that. Now, there are something new that you probably have to learn, especially it's a medical system here. So while you're in the hospital, other team members come into play more and more. So in Thailand, you probably have interactions with your attendings, nurses, and that's about it, right? However, here, they're totally different. Like you have to interact with social worker. They're part of the game. You interact with case manager. You have to interact with the rehab facility, the long-term acute care facility, the skilled nursing care facility. There are a lot of facilities like this that when we discharge a patient, that may be their disposition. So when you do that, you end up having to know everything inside out and interact with multiple peoples, and we are part of the team, which means we are not the head of the team. We are part of the team. Everybody plays their part. And that's the beauty of the medicine here. You don't just be a doctor and saying, okay, you do this, you do that, you have to follow my orders. No, so everybody play the same part. And that was some adjustment because, well, I don't know that long-term acute care is such a thing because there's no such thing in Thailand, right? There's no such thing as skilled nursing care facility. Maybe there's some right now, but they're not as popular. And most of the time in Thailand, when your patient's ready to be discharged, they got stuck in the hospital because they have no place to go since they're not well enough to go home. They still need some help from the nursing. But here, you can probably discharge those patients to skilled nursing care facility. They can take care of that before the patient's strong enough to go home. So those are some adjustments that I have to make. Now, throughout the year, obviously, as a foreign grad, you have to prove yourself that you're worthy enough in their country, right? It's a very, very common thing for people to judge someone they don't know. For instance, if you're not from their country, they probably have a lot of questions. How can you be qualified? Are you really qualified here? Do you fit in? So in order to make sure that you get along well with them, I typically, well, as I mentioned before, you kind of understand their culture first. What is the popular games here, right? And what do they care most? And so this way you can approach and engage in conversation in a non-medical way, which I think it kind of breaks the ice, right? If you are talking to them as a professional only, there could be a barrier between you and them, and they might not trust you. But however, if you can befriend them by doing something outside medicine, I think that's a very, very good approach. So that's something what I did as well. And this way you can really understand because there are a lot of cultures here and there are a lot of religions here. And, Jewish are common here as well. So I don't know anything about Jews when I first start. But then you start asking them questions, they can explain to you more in detail what Jewish means and what their beliefs are and what are the importance of certain things. So this way you don't, make mistakes and insult them without knowing. Most of the time we don't intend to insult anyone, but we just do that without knowing. So this way, when you befriend someone, you learn a little bit more and you get along quite very well. And over time, you can prove yourself worthy in this country. And that's what I would suggest doing. It might be a little bit longer process, but it's doable.
Thank you so much. That was very insightful, Dr. Tenny. So for the second question, it relates back to the first question, and that is, amidst this all, like the effort that you have to put in, such as having to adapt to the quality of work, the lifestyle changes, going from a dependent country, going like the country where people stick together to being a more independent country. I see that you have to put in much more effort. You have to adapt to fit in with other people. So my question is, why put in all this effort to stay in a foreign country? Why not just be a physician in Thailand?
Well, first of all, this is to broaden your horizon, right? So if you stay in Thailand, all you're going to know about is Thailand. You won't know about the rest of the world. And Thailand is a very tiny country, right, compared to the rest of the world. And these days, well, world are connected. I would say if you have a chance to go somewhere else just to experience, go. United States is one of the country where the technology is at its peaks, right? So if you come over here, either as an exchange, or you might come for an observership, or you may come over here for residency and then fellowship or further study something else, I think that can broaden your horizon, and eventually you can pick and choose. If you pick to stay here, it's not a problem. If you pick to go back to Thailand, you're far ahead of your pack, because remember, if you want to go into a very good hospital in Thailand, especially the private one, they favor United States grad doctors, right? Unless you have very strong names, or you probably one of the very top doctors in big university in Thailand, you won't be able to get into such prestige hospital. And this way it increases your choice, whether you want to stay in Thailand, want to work here, or some people go back and forth. So maybe some of us can actually work 6 months in Thailand, 6 months in the United States, and some people will do that. And it's possible to do that as well. So this way, you kind of you're not going to limit yourself to just one country. You can limit yourself. You have no limits. And this way you're probably able to enjoy yourself a little bit more. And you see what other countries are doing, which is not exactly like Thailand. There's a lot of differences in how we practice. And if you have a chance to talk to one of those observer that came over to observe me when I'm on service, they can probably tell you what's the difference. And if you are interested, we can go into detail a little bit.
Thank you so much, Dr. Tani.
I think if we have a chance to go around other countries or travel the world, yeah, I think we should. And US is a very good choice.
Yeah, just like if you have some vacation, right? You're going to Japan, you're going to somewhere else that's not Thailand. You want to travel abroad, you go to France. The same reason, you go there just to experience the world, and then eventually you can pick and choose. Somebody might choose to, settle down in France, maybe in Canada. And why? Well, because they know what's the difference, and if they think they're better opportunity over there, why not, right? But first, you need to know what they are like first, and what opportunity can you be getting over there. If you don't know any of those, well, you're not going to be going anywhere, right?
Exactly. Next, we're gonna move on to about YouTube. You have always been punctual with your YouTube uploads. Do you have any advice for current medical students on how to manage their time while studying and participating in extracurricular activities?
Well, let me explain why I did the YouTube first, and then I can go into your questions. I first started my YouTube channel when the COVID hits. And I know at that time, United States was very, very, it's extremely dire situation over here when COVID hits. So I experienced it firsthand. I see the patient in the ICU, a bunch of things. And then I start seeing many of the social media in Thailand start posting something that is not real, not true. And there are a lot of misinformation or disinformation in Thailand. So that's when I start to think about, okay, what if those misinformation get circulated to my family and they don't know what to do? So I make the video so that I can explain to all of my family and friends to try to understand what COVID is and how to treat them, and in many, many aspects. And that's how I started. But for some reason, it took off and some people start watching. So I said, okay, let me just probably talk about something that is useful as well. And the reason why I do that is because there are a lot of misinformation about many, many things these days. You know, you share something by line and somebody just read that and believe in it, which I think when you read it, you kind of know right away that's not true. And I just don't know why people believe in those things. And some even say, we have the research to back up. And some said, oh, there's research from Harvard to back this up. But they never show me the research, right? They just mentioned there's research out there to back this up. But when you don't know what it means and you don't really understand research, that's kind of an interesting thing to believe. So my thought is, well, I will want to make a YouTube to make sure that people really understand. And my YouTube is always going to be a little bit more in depth into the details. I do not want people to know just the superficial knowledge. Like, that's why my video is always long, because I want to go into detailed explanations, including sometimes medical terms. But I try to make it easy for people to understand a little bit more. And this is intended for if you are in your high school, you can probably understand me. But if you're younger than that, might be having a little bit difficulties in understanding, but that's okay. You don't have to understand everything. And that's why I want to do all these things. Now, I want people to have the habit of learning. And how to do that? Number one, I have to do it in Thai. I don't do it in English at all. The reason for that is because, well, I'm here, I want to serve. How could I serve my country best? It's by speaking Thai, right? If I speak English, then not a lot of people will understand that. I have to be honest with you. Even though you probably have an English class since kindergarten, you probably don't understand anything. Even if you're in university, sometimes people with 12 or more years of studying English, they don't speak or they don't understand at all. So I have to speak in Thai, and this way I get a wider audience so that they probably understand more. And then the habit of learning I make was that I myself learned one new things every single day. It doesn't matter what that is. Might be a little thing, might be a big thing, might be medical related, maybe non-medical, maybe just a cartoon, maybe it's about cooking, maybe about music, whatever that may be. I have a habit of learning one thing in each day. So that's one of the reasons why I post every single day, so that people learn one thing every single day. I know that sometimes my video can be too much because it's on daily basis, and most people will not be able to catch up with that. But that's something that I will continue doing until I have no further thought about, okay, what I should be making next. Now, how do I make my day productive? There are many things that I would think about what's important in your life first. Obviously, studying in medical field, well, that's important. I mean, you should be studying every day if you can, because, well, it's hard to study every day, first of all. However, it's going to benefit you at the end, because when you graduate med school, that's when you have to use all your knowledge you have acquired over time. Now, if you have no acquired knowledge, it's going to be very, very difficult for you to thrive. So that's one of the habits you should make. Another thing is, you don't want to be the medical student that only studies, right? If you want to be the nerd sitting in the front row every single day, listening, lecturing, and everything, and when you are done with that lecture, you go home or to your dorm, start reading, and that's all you do? No, that's not life. life needs more balance than that. You need what? You need body to be strong, right? You cannot just go without exercise. Maybe you can when you're younger, but when you get older, your body gets weaker. And if you start exercising later in life, that's a lot harder. So I built my habit of having to exercise every single day, despite how busy I am. So that's built in. And the third thing, to me, I acquire whatever knowledge once a day. In this case, it is the, obviously, some of them are medical knowledge. And now I built in YouTube, right? And you have to do something for relaxations. Now, you need to prioritize. Just like the old saying when, you probably have heard about this multiple times already, like you have one jar, a big rocks, sand, and water. How do you put all of them in a good, and so that they fit in? If you put in water first, nothing will ever fit in. Everything will come out. If you put in sand first, the big rock will stay up there, right? So you need to put a rock first, and then a sand, and water, and that's basically how you should be doing as well. That's how we call that is how prioritizing come into play. So in your life, you can prioritize whatever is important to you, then you try to have determination to do it. So to me, for instance, if you want to build in the exercise routine, what you need to do is not to set a time. Let's say I have to exercise from 5 to 6 or 30 minutes at least. Otherwise, I will not be doing exercise. I am tired today. I'm on call. I'm post call. I don't want to do any of those things. No, you don't have to do any of those. What you should be doing is set your determination once a day. Doesn't matter how long. Maybe you have 2 minutes. Maybe in that 2 minutes, you can do jumping jacks. Maybe that 2 minutes, you can do push-up. Maybe that 2 minutes, you can do squat, lunges. But put your mind to what you're doing. That's all I'm asking. You don't need 30 minutes, 60 minutes. But once you put your mind into doing something like that, over time, it starts to become your routine. And then over time, you start seeing results that your body gets stronger. Your minds get clearer, right? And this way, you start seeing benefit yourself. And then you'll be doing it more and more automatically. When you learn about one thing every single day, you will make use of that in no time. Like when you talk to people, you will be able to use that to engage in conversation. So to me, knowing Thailand, I know some of the history behind certain things. When I talk to my friends here in the United States, I can say, hey, Thailand has so-and-so. If you want to go to Thailand, this is when you should be going, those kind of things. Such an easy thing to ease in your conversation. That's come into play as well. If you know cartoon, well, maybe you can use that to your advantage. Maybe when you go for an interview, right? Because in the United States, there are a lot of interview before you get a job or your position in residency. And you see when you walk into the room, you see there's a picture of the kids in there. Maybe it's that professor's kids, right? So you can, start a conversation by, oh, I know at that age, I watched this cartoon and it's very popular in Thailand. Maybe you should ask if your daughter or son would like to watch that. And that's a good way to start a conversation. You don't have to be so, sturdy in just one area. Like you don't want to go in there, have them ask questions about things. So you start building number one priority, whatever that may be. You can add maybe 3 to 5 things you want to do in a day and then prioritize it. And when you do it, mean it. You want to do it, you mean it. Over time, you develop your routine. And over time, you'll be able to put a lot of things into your day. So to me, I post YouTube on a regular basis. How I do that? I record a video when I'm not on service. And then I set the timer to post it. But one of the routine I developed from that is that I have to read every questions and answer every question. And I think to me, that is very important in many ways. Because number one, I do not see that there are many YouTube channels that answer every of your questions. And some of them, it may be something that people need help with. And that is something I can probably step in and help a little bit. It might not be perfect, but it's better than nothing, because some of the information can be very hard to come by. For instance, I post a lot of like weird disease in which if you were to have those diseases, right, how can you find information about diseases? You might not be able to read English. Even if you can read English, it might be too complicated of a disease to understand. And that's the reason why I answer some of the questions. And I know then by answering the question of what is important for these people and what's their concern. Maybe when I make the next video, I can make sure that I address all of their concerns. And I can check whether the video I made before is covering all the aspects or not. The next one should be better. So every single video, I make myself better. And this is called self-improvement, in which you should be doing as well. It's something that you always evaluate yourself from all angles, not just because you look at yourself and think that I'm good, you're good. No, not that. You probably have to reflect yourself from others. You ask them, and in this case, I look at the comments. I look at people who think maybe there's something that it could be improved. I take those into my consideration and see if I can improve that or not. Some of them, you improve all of them at once. You may be improving one or two first, and then once you're comfortable with that, then you move on. So this might be a very long answer for your question, but I think it's kind of laying out some foundation for you to understand a bit more about what I normally do in a day. All right, over to you.
Okay, I think that the reason why you start doing YouTube first for your family, I think is very sweet and thoughtful, and then you move to for Thai people in Thai language. And I think that your content about, like, you have some contents about reading research and explaining. I think it is so informative, and I can gain much more research skill from that. Especially my friends, all my friends really love your contents about the sleeping hours. It's very help us with our study and life. And also the idea of start doing something that like don't care no matter how long it takes. It might be 1 minute or 2 minutes about meditation, the video you make. Just start doing it. I think it is very helped me in many ways, and it is such a durable thing to start.
I'm glad that you like that. Hopefully it would be helpful to many of you, which I think it's tough as a medical student trying to learn all of these very difficult subjects and very broad, let alone try to balance your life. And I hope that knowing that I've gone through that before, maybe sharing some experience might help you out.
Okay, and so the key of your productive is first have a life balance and also prioritize things, right?
Yes, and you need to have both strong mind and strong body together. You cannot have one, right? So to me, I exercise every day to make sure that I can endure the hardship of medicine. I practice every day so I get faster. I get more efficient in treating patients. This way, I save a lot of time, right? And I also need to have enough rest. And I know when you're a medical student or when you just first graduate, it's hard to have the balance, because when you're on call, you're probably up all night. You get 1 hour of sleep or maybe no hours of sleep, and the next day you have to work like nothing were to happen. I have done that before, so I know how hard it is. The other thing that you can improve upon, even though you don't have enough rest, I think that's important. So I post a YouTube video about what if you don't have enough sleep and you have to work on. To me, some kind of meditation helps a lot. It doesn't always have to be you sit down, close your eyes, and then do something in your mind to calm yourself down. You don't have to. You can just concentrate on something, maybe just by looking at something, looking at the flowers, trees outside. Use your all 5 senses and really concentrate on those senses. It's kind of calm your mind. Even though you don't have a long night's sleep, you can use this method for a very brief period of time, and it can be very helpful. And to make sure you have enough food or water, during this time, but not too much like bubble tea or snacks. That's probably get you diabetic or having other issues later on in your life.
Your video really helped me get through my study year.
That's good.
And I really love that you mentioned about sometimes you have to rest, or I never know before that sometimes I read the cartoons. It's also have a benefit to my life as well.
Yeah, anything that you do will have some kind of benefit. You just have to know about it. That's all. You have to try to use it. Some people are very good at dancing, but does dancing has anything to do with medicine? Well, no, but then it kind of balance your life out, and you might be better at having body control, and that might be a skill that you will be using for your surgery rotations. Maybe you play a lot of games, you have a very good hand and eye coordinations, and when you are in your higher year, you can put in a central line, you can put in something, you can do a scope with ease, because you are very good at hand and eye coordination. So there are a lot of things that you can look in the good ways, in the bright way. So anything has something that you can use, and there sometimes can be pros and cons about certain things that might be good or bad. You just look at the bright side. That's how you should view the world, rather than why am I having to suffer through the years? Why do I have to study all these 500 pages, and then Friday I have the exam upcoming? How can I put that in my brains? How can I survive this rotation when the attending is so intense? Those kind of things. You look at the bright side, always the bright side.
Okay, next it's gonna be about AMSA. So in one episode, you mentioned that you were a president holding conference in Thailand with around 400 participants when you were studying in in Thailand as a medical student. So what is your motivation to start doing that?
I wanted to know more about other countries, how their healthcare system operates, and at least make more friends. So I kind of joined this project when I was in my second year. At that time, we have to come up with some kind of research projects in which if we present a research project and we win, then we get to go to other countries and then be a representative of our country. So that is something I did. And it's kind of very good, and more friends by doing so. And they have certain nights where you don't just go into just medical stuff alone. You can just make friends. There are nights where you dance together, you sing together, you go out to hang out together. I think that's a beauty, right? Rather than study alone. That's kind of boring. So I continue doing that. And then for some good reason, on my 5th year, when I was a 5th year medical student, I got elected as president for organizing the conference. That's when things get very challenging, because 5th year, you probably know that it's quite busy. It's in your clinical year. There are a lot of rotations, and I think I was in the middle of one rotation, which is the psychiatry rotation, and another is anesthesia rotations, in which I was out for several weeks and then having to come back to take the exam. So I have to balance a lot of things, try to organize the meeting, you have to get funding from the government, get funding from various sources, organizing the hotel. How can you fit in these 400 delegates from different countries into your conference room? How do you travel from one place to another? Because remember, Thailand's traffic is very notorious for being really, really bad. So how you manage your timing is of the essence of how to get the conference going, and how to make people happy, because you cannot just arrange the conference in one locations. Like if I arrange the conference only in Chulalongkorn University or the hospital, what about the others, right? Rama, Siraj, or other university? We should make them proud as well. They should be part of the game. It's not like I'm at July, I just have to take all of the credits myself. I have to share the credits. And then you have to be able to work with other people as well. It's not like in the company where if you're the head of the company or you're higher up in ranks, you can tell your subordinates, okay, just go do this, go do that. In these conference, you are equal. You're all medical students. You are probably from different school. So how do you negotiate with them that, hey, please do this? And I think that's a very good experience because you learn a lot of things. Number one, you learn how to manage your time well between studying and arranging conference. You have to at least discuss with your friends abroad, maybe once a week or maybe twice a week. You have to talk to the government. That's different language, how you get in touch with them and what they want. You also have to know how to manage people in a very, very challenging way because they're all your friends. You cannot just say, hey, go do this and go do that. They won't do it for you. If they don't do it for you, the person who's going to suffer is you, right? Because nothing will get done. And then you bear the name of the country. So if something goes wrong, well, you are the one who takes the blame. So I think it's very, very good experience that you learn a lot of things. And even if the 5th year is so busy that most people don't want to do any of these, which I understand, when they become a part of the committee in AMSA, they don't want to do this because it's hard for them as well. So we have to come up with a way to compromise and make sure that everybody can do and successfully doing the job at the end of the day. Now, by the end, we are very lucky that the conference came out super successful. One of the most successful conference that I've ever attended. So I have to give the credit to all of the staff that work alongside with me. They are tremendous help. Like you work with them, they work hard, they fought like hell, try to make this conference happen. So you have to give credit. So if you are the head, you should not be the one who take credit. To me, I think the one you should be giving credit out are the one who work for you. They're the biggest part of how the conference can be successful. And I think this is also true in medicine as well. Usually, you typically will see doctors as the head of the team, and they take the credits, right? Oh, this patient is getting better. Oh, it's because of you, your doctor, right? Ajahn, something is so great that they cure my mom, those kind of things. But I think that's probably the way that should not be something that we would keep. You should be giving credits out to the nurses because they are there with the patient 24/7. They know the patient inside out, and other people as well. You don't have nurses and you just have brains up here. You can just tell them what to do. If they don't do it, what's going on, right? So this helps you be a better team player and be more humble. And I mean, this isn't a good way because if you progress to your year, you get more confidence. Especially the 6th year, you will know, like from the 5th to the 6th year, when your white coat from long white coat get to short white coat or something like that, you gain confidence out of nowhere, and then you start to become one of those who say, okay, do this, do that, right? But then you forgot to give credits to other people, like other medical students in the younger year, the nurses. I think that's also important as well. So to me, if you have a chance to do some kind of extracurricular activities, please do so. It makes you a very good human being at the end. Studying alone does nothing, because when you graduate, medical knowledge alone will not make you survive. All right. that's all I have to say, I think.
Well, thank you so much for that. And I feel that was really insightful. And I think what you said could potentially motivate medical students to participate in more activities, because you also, apart from the medical knowledge that you get from working, you also mentioned how you made a lot of friends. So I believe with this like social aspect, it could be an incentive for current medical students to also participate more in these activities. And I also agree about the importance of being considerate of other members when working as a team, because I also agree with you that we should view working together as more of a team, not you being a leader taking care of a group of people. And you should also give credit to them, which I really admire your mindset. And yeah, I really agree with you. And for the next question, I'd like to move back to talking about your YouTube channel. So aside from all the medical knowledge you've taught to the public from your YouTube channel, I believe that your channel has also served as such a huge source of motivation for medical students. So would you mind sharing some of your experience or any takeaways or lessons that you may have learned from doing YouTube these past couple of years?
Yeah. So I think I start to inspire not only laymen's people so that they understand a little bit more about medical knowledge. I also intended to educate some of the medical students, well, as probably you may notice, like most of my videos, I don't just be superficial about things. Some of them are even important medical knowledge, but I try to say that in layman's terms so that people can understand. I start mentioning about certain names of the medication, certain tests, which they are important as well. Sometimes I draw out the diagram. And I think because it's hard for us as a medical profession to listen to another doctor. You know, when I listen to other doctors speaking on YouTube, I try to understand, see what they're up about. Maybe they are saying something, actually most of the time, they're too superficial for me. Like I don't gain any knowledge by just listening to them because I am already in medical field, so I need something more in depth. But in the meantime, you will want to give the information out for other people as well. So I try to balance both. Like part of the talk would be something that's more towards general publics, and some will be a little bit deeper towards doctor, and some even for specialists in pulmonary and other stuff as well. I can guarantee you that many of the knowledge some of them are very, very hard to come by. And I tried for many years to accrue those knowledges and then try to give it out to other people. And that's when I think it's important. And I start to see some of the outcome as well. Like that's why there are medical students who would like to come over and observe me, which I think is possible. Hopefully. And I hope that whoever come over to observe me, I don't scare them away by how busy I am as they're attending over here. And also, so I think I will keep doing this way. And obviously, if you have any further suggestion of how I should be making videos, then I will take that into considerations, and how I should be doing for medical students, I might be doing that a little bit more. One thing that teaching medical student alone could be challenging for me is every time I do that, I have to go into the details about many, many things, and then have to have a lot of research as a backup of my claim. That usually takes longer time to make in terms of videos. But if it's something that I can just say from what I know already, and that usually is easier. Like most of the video you see me do, I don't have to read anymore. I already know about those subjects. Maybe a little bit more brush up, and then I can talk until the end of the video. So I'll keep doing that for you guys, and I will make both of the medical knowledge videos, and also probably some of them are inspiring videos, or how to get through the hardships, how to get through the intern year when you are now probably know about all the drama we have during this time of the year when people graduate and they have to work in the upcountry. So we'll see. We'll see.
Thank you so much, Dr. Kenny. That was also another yet insightful piece of information that you gave us to the listeners. There's a point that I would like to touch more upon, and you mentioned this earlier, which is basically, do you have any recommendations for us? But I'm sure you already mentioned quite a lot on that already, including the practice of prioritization or even meditation.
Mhm.
So I would like to change the question a little bit, and that is, if you could go back in time, would you still take the path on like where you are now, specifically such as being a university lecturer abroad? Are there any habits you would like to recommend to, like, let's say you as a medical student when you're in your second year, let's say?
Sure. I would say no, of course. And if you ask any of the accomplished persons, they would all say no as well. And the reason for that is because we base our decision at any time on information that we have, knowledge that we have, and circumstance at that point. So it's always going to be the best decision we could have made in the past, and that will not change over time. And when I say we make decision based on those stuff, it's kind of very important moving forward to make decision your best decision ever. It doesn't matter what you're doing. Always make them the best decision, and then do not look back and regret on anything. That's the key word. When you look back and you start regretting something, that's when you start blaming yourself. And when you start blaming yourself, you start limiting your full potential of getting better. You should reflect on yourself. Maybe you did something wrong in the past, but you did something wrong to learn that is wrong. It's no real wrongdoing. It just, it's not correct way of doing things. Just learn the new way of doing things. So if you try certain things in the future and say this way does not work, maybe you then learn that this way does not work. You try another way. If that another way does not work, maybe you try the third, the fourth, the fifth, whatever that may be. And then you eventually learn, okay, I learned 10th way of doing this thing, one way being the best of how to accomplish what you're trying to do. And then whenever you face the same situation again, then okay, I know 10 ways of dealing with this problem. Now I know this is the best way of dealing with it. And if you have any younger person who come up to you and, ask for your opinion to see what you want to do in this situation, you can tell them, hey, maybe this one works. You should be trying this. So anytime trying to make your decision the best ever, don't go back and regret on it, but reflect on that. Just learn about it. There's no right or wrong. There's always something. It depends on how you view the world, as I mentioned before. And I think that's very important. I would not change anything moving forward anyway. Even if I can go back in time, I would not change.
Oh, I see. Thank you so much. So so going back, asking, so I conclude that you don't want to change, but let's say from an outside perspective, your point in your career path is very, very far. So the question that I would like to ask further is, have you accomplished your goals yet? Like, where are you headed next? Or, like, are you going back to Thailand, or are you staying in the States? And or is there any like future goals you still have not yet checked?
I think this is an interesting question for many reasons. Most of the people will have some kind of goals in their mind. And most of the accomplished person will have some kind of goal in their mind. However, for me, I have no goal in my mind. I just want to live my life in the present and make sure that I do everything I can to make the present moment the best ever I could make it. And that's what I'm doing. And actually, that's what I have been doing in the past. If you ask me when I was younger, like maybe when I was in my teens, my goal in life is to be a great person, to look good, to be strong, to get handsome. Doesn't matter what it takes to do that. That's how I want to do. And then I start questioning myself how to become a great person. Well, maybe I should study hard so that I get very good knowledge, and maybe that makes me a great person. But then, well, if a great person doesn't look good, they don't have muscle, they are weak, they get sick all the time. Well, that's not what I want to be. Then I start exercising. Okay, you have good heart health, good good muscles and everything. Well, should that be enough? Well, no. How about music? How about drawing? How about arts? Then I start exploring in those. So to me, life is always about exploring something to make me a better person of my full potential. So I keep exploring that. I have like no definite goal. Like I want to be number one in lung transplant. That's not even my goal. I want to be number one in the United States, number one in Thailand. Those kind of things is not even my goal. I want to just live my life in present and do everything I can to improve myself all the time. I would say maybe my goal is I'm achieving my goal every single day because I'm making myself a better version of me every single day, right? I acquire one knowledge every single day. I exercise every day, which means that I'm improving on my health every day. I practice on my music here and there. I draw and those kind of things. And I practice speaking on YouTube very often. So I think that's very helpful. Whether I'm going back to Thailand or not, that's the matter of future. So to me, if you're in your best version all the time, then when the time comes, when the opportunity arises, you will be able to grab that opportunity and make it happen. That will materialize, right? But if you are not ready, you're not the best version of yourself, when opportunity arises, you might miss it. Even if you try to grab it, you might not be able to do so. And you get very frustrated of how come you're not ready. Why you're not ready? You start looking back, you start blaming yourself. Oh, if only I did that, I would have been able to grab that opportunity and be successful, right? So to me, I get myself ready all the time. If there's an opportunity coming in the future that I go back to Thailand and I get what I want, I'll be happy in my work or whatever that may be, I might consider in the future. Yeah, that's what I would say. And it might take some time. And some of you might know that I have a company in Thailand in which eventually I have to take over anyway. So it depends on how much time I would like to spend in Thailand. My sense is I might have to do half there and half here.
I think you are drawing the song you write, and your piano is so beautiful. So he's doing everything.
Yeah, the piano, I would say I'm not that great comparing to other of my peers. They're very a lot better than I do. So they play classical piano. They play difficult pieces which I cannot. But to me, I think music is music. Music comes from inside. Music describe you. Is the way to express yourself, express your emotions, those kind of things. So when I play it, if I play somebody else's song, I would express myself in that song. It doesn't always have to be punctual with every single notes. I don't play the exact same note. I might invent some of the note and put it in. Or sometimes I just make up the song on the spot, just describing myself, expressing myself at that moment. I think that is something beauty about music, and it's also helped with my practice as well. So if you understand arts, you understand people or patients in emotion. You understand them as a person rather than them as a disease that you have to fix, right? Why some people have diabetes and still eating sugar cane, right? Why don't they come to the hospital? Why don't they take this medicine? Why they're so fat? Why they don't lose weight? such thing. Like you really need to understand coming from their perspective. And if you can unlock your emotions and you really understand the music, you can actually understand people not that hard. So that's something I learned from music, and you can be more sensitive to certain signs that most people will not be able to pick up. That's also including physical examination. There are certain things that you need to be very sensitive to it to pick that sign up. Like sometime I go to the room. Oh, there's actually one case I might want to share with you. So there's a person that I've seen as a medical. Oh no, that was when I was an intern. That person come to the hospital for some kind of neurological symptoms. I forgot what it was. But then everybody comes to see this person and say, hey, he's normal. We did all the neural exam. Everything looks normal. But when I went in and that person did this, he waved at me, hey, how are you? And he didn't even know me at that point, right? And everybody thought that was kind of, well, maybe he's a friendly guy, but he did this to many, many people. So I would say that is not normal. There may be some lesion in the frontal lobe that caused your behavior to change. So the next thing I did was I did all the frontal lobe sign check, and then, it's positive. The next thing I did, okay, we subject you to imaging study and we found a tumor in the frontal lobe. That's how I use the ability to understand a little bit more. It's like you have to be sensitive to certain things. Even though you do a full neural exam, everything looks normal. I mean, you move your arms, you test all the cranial nerves, everything looks normal. It doesn't mean that it's normal. It's just that you have to pick up certain signs. So that's something. And drawing is the same thing, that you improve upon your hand skill. Yeah, I think that's useful.
Before we conclude, can I ask one more question? I see that you specialize your career specifically in the pulmonary region. Is there like any moreover, it's more of a like why did you choose this part? Is there any like motivation or inspiration behind like why you chose this specific branch in medicine?
Yeah, it starts from medicine first. So to me, when I was young, I only know about one kind of doctor who knows everything, right? I don't know whether there's a cardiologist, there is gastroenterologist. I just know doctors are doctors. They're supposed to know everything about everything, right? So then the closest thing to that is, to me, internal medicine. So I picked internal medicine because this way, you probably by now have seen some of your cousin or your family start asking you, oh, I have this thing. What do you think it is? How should I be treating it? Even if you're in your second or third year, you don't even know what that is yet. So to me, if I know almost everything, that would be internal medicine, and then I can become more useful. Then I would like to keep this mentality moving forward. And I think doing pulmonary and critical care allows me to do that. So critical care is actually the ICU, basically the sickest of the sick, right? So if you know everything about every little fields, that makes you a better critical care physicians. So that's why I went into critical care as well. The pulmonary part, well, you need to do something with the breathing machine or ventilators, and that can be interesting than other fields, and they have no idea what that's all about. They don't know how to take care of that. There are also very interesting things about the lungs in terms of diseases that see in the lung can be very challenging. And then at the end, I graduated pulmonary critical care, but if you're in the United States, if you have a chance to go to the topmost, you want to go there. I want to go to the farthest point of something. There are a lot of, I would say, many branches down from pulmonary. As let's say pulmonary vascular disease, interstitial lung disease, interventionist, and transplant, or other thing as well. So I chose transplant because it's, if you have whatever lung disease that is incurable, lung transplant is the ultimate goal. It's ultimate of everything that you know. It also has something to do with immunology, which I like for some reason. Some people hate immunology because it's difficult to understand. But I think sometimes it's difficult because the one who teach you make it boring. if it's any subjects make you bored, and that means maybe the way of studying it might not be the way that you should be studying, or the way that somebody teach, it should not be that way. I can teach some of the immunology to the people who are not even a med student. Like I have, like one of the student I have is not even a medical student yet. I can teach immunology so that she or he can understand. It's not that difficult. You just need to put it in a way that's interesting enough for people to learn. Now, this is in teacher perspective. However, as a learner perspective, I would say you should find a way to make things interesting to you. And this way you will learn. And always questions of how are you going to use this knowledge in the future? What if you see this patient yourself and you don't have your attending or any consultants around? You have to deal with this thing. How can you take care of that patient? If you can use all the knowledge. That's make you a better doctor. And also it can help you a lot with the exam, which I'm sure people have a hard time finishing what they're going to read, right? But if you keep questioning every little step that you take in reading, then you would know exactly what they're going to ask you in the exam. And that make the exam a lot easier. And that's what I did. I rarely ever finish reading the entire chapter, but I can guess what will be on the exam. So that's how I think it's useful for you guys as well.
I think it is very useful. So from now on, I'm gonna start questions more things in my study and life.
Yeah,
so
that's
for
good.
the for the last part, is there anything else you want to say to all of the people listening to you right now?
I would say be the best version of you, be productive. Anything in your life is important and they have use. Nothing is useless. And don't look at yourself as an unlucky person. Don't look at yourself as a failure when you look back. Look on the bright side. There's always the bright side. So take that side out, look at the bright side, and the world will be a lot brighter and better place for you to live in. And you will fit in the society for sure.
Thank you so much. And that's it for our questions. Thank you again for being here and taking your time to speak with us on these topics. We believe your advice will have a positive impact on medical students and will also be a great motivation for many of us.
Well, thank you very much for having me today. It's been a pleasure and honor to be able to give back to all the younger medical students. I have gone through that year before, so I hope that my knowledge or experience can help you in some way. Thank you very much.
So, okay, and if you guys love this content, we have two platforms, both on YouTube and Spotify, so that you can subscribe or leave some comments if you want to share your ideas. And the most important things, don't forget to subscribe to Dr. Tani YouTube channel.
Thank you very much for helping.
Thank you so much, Dr. Tani.
Thank you so much.